Welcome. Aortic valve surgery can be accomplished through a variety of approaches. It can be done through a full sternotomy, a mini sternotomy, a mini thoracotomy, or through a transcatheter approach. Transcatheter aortic valve replacement has become more popular given its faster recovery time. However, the long-term durability of transcatheter valves is still unknown. Younger patients with a long life expectancy will benefit from traditional aortic valve replacement either with a mechanical or a tissue valve. The use of a mechanical valve is beneficial in young patients because it lasts longer and therefore is associated with a lower rate of reoperation and improved long-term survival. However, a mechanical valve requires lifelong anticoagulation with Coumadin. Tissue valves are preferred in older patients. They only last 10 to 15 years. At the end of that time, the patients will either require a reoperation or it can potentially be treated with a transcatheter procedure. Tissue valves do not require anticoagulation with Coumadin except for the first 3 months after the surgery. Minimally invasive aortic valve replacement is done through a 2-inch incision either on the middle of the chest or in the right side of the chest. An additional incision might be necessary in the groin. You may ask, what operations can be accomplished through these small incisions? We can perform aortic valve replacement or repairs, replacement of the ascending aorta, and replacements of the aortic root. The main advantage of these approaches are less pain, faster recovery, and decreased need for blood transfusions. Thank you.